My name is Nikki Hastings. I'm a geriatrician and a researcher at the Durham VA Healthcare Center. A major focus of my research has been improving care for veterans that are discharged from the emergency department. And many people think of the emergency department as the front door of the hospital, and indeed it is for many veterans. However, the majority who seek care in the emergency department are evaluated, treated, and then released to go home after the treatment plan has been formulated. It's 75 to 80% of all veterans that present to VA emergency departments that are actually discharged home. And so I've been very interested in this transition based on my own personal experiences of working in both settings, the emergency department and primary care. And working in both those settings really showed me the challenges that patients face as they transition between different settings. For example, in my primary care clinic, I could see how difficult it was for veterans to understand the sometimes complicated discharge instructions that they receive, like how to take their new medications. But being on the emergency department side, I could also really appreciate how difficult it was to convey information in that setting. So the study that we just conducted was a randomized clinical trial that examined the effectiveness of a primary care-based nurse intervention for patients treated and released from the ED. We focused on patients who had been in the ED or hospital at least once before in the past 6 months, and those that had 2 or more chronic conditions. And we structured the intervention to be delivered in 2 core phone calls. So on the first phone call, the nurse really focused on, did you get your medications? Do you have an appointment to go back and see your doctor? Do you know what to do if you get worse? Do you know what symptoms might mean you are getting worse? And really focused on getting the care delivered that the patient needed based on the initial reason they went into the emergency department. On the second call, the idea was, the dust has now settled from the initial visit. Let's step back and take a bigger look at your overall health and see if there are other VA programs or services that can help get things back on track. And then the nurse interventionist was available for up to 30 days afterward for any other issues that would come up. These were often issues dealing with VA benefits or care coordination kind of problems. We followed the veterans for 6 months, and then we looked to see what kinds of VA services they had in fact used during that time period. Some of the main things we learned from conducting this trial were that, number one, veterans really welcomed this kind of support after an emergency department visit. The second thing that we learned is that we could successfully get patients back into primary care in a more expedited fashion. So the veterans that were randomized to the intervention program were more likely to see their primary care provider within 30 days after the emergency department visit. What we were not able to do is reduce the likelihood they would come back to the emergency department. So we saw equivalent numbers of return visits in the intervention patients and in the control patients. What I'm also really excited about is that we're going to be incorporating the veteran voice into the next phases of our research, because we really feel like the answers of what we need to do to support patients better in this sensitive time after an ED visit lie with the veterans themselves. We have a veteran engagement panel at our Center of Innovation for Health Services Research in Durham, where we have a wonderful group of veterans who sit with us on a very regular basis, hear our research findings, hear our research ideas, and give us really incredible and valuable feedback about how we can make the research more appropriate and responsive to what veterans really need. I've worked with Chad Kessler, who's the director of the National Emergency Medicine Program for the VA, for a number of years, specifically on this project, and it's been an immensely valuable experience. He's really able to represent the landscape of VA emergency medicine in a really important way, in terms of making sure that our research is practical and could be put to use immediately and in a meaningful way. So that's been a really important partnership. But of course, studying any transition implies that there are at least 2 settings involved. So the emergency department and emergency medicine partners have been incredibly important, but also primary care, because that's the receiving service, if you will, who are picking up the ball and taking it forward. I appreciate all the veterans that have participated in research studies of mine over the years, and most particularly I appreciate the veterans that participated in this trial. We enrolled 514 veterans in this trial, many of them 2 or 3 days after they left the emergency department. Really challenging time to participate in research, and yet they were willing to do it, even understanding that half of them would be randomized to the control group, meaning they wouldn't get to participate in the program. But they told us time and again they were willing to do it because we might learn something that would help other veterans. The altruism that we see among veterans and the willingness to commit their time to help other veterans it's amazing.